Ascend Telemedicine's approach, enabling immediate access to care, could help save the lives of hundreds to thousands of infants suffering from neonatal abstinence syndrome. Every 15 minutes, a baby is born suffering from opioid withdrawal. But recent regulatory changes will allow the use of medically supported therapy to be completed remotely, allowing for increased access to care. Patients will now have access to medication-supported therapy 24 hours a day, 7 days per week. This approach can make an immediate impact in Arizona, as the number of infants born with opioid withdrawal symptoms increased almost five-fold from 15 cases per 10,000 births in 2008 to 73 per 10,000 births in 2016. Only about 2 in 5 pregnant women addicted to opioids in Arizona receive medication-assisted treatment, according to the most recent tracking by the Arizona Department of Health Services. Rural areas in Arizona have the least immediate access currently, with Gila County having the highest rate of babies born suffering from opioid withdrawal. Ascend's model will create unparalleled access to care throughout Arizona, creating better outcomes for long-term recovery. The multifaceted approach connects data-wavered providers, therapists, peer health coaches with patients, leveraging advanced marketing, education, consultation from providers, all accessible from the privacy of home. But how? Ascend's innovative approach will improve and simplify access to care, displacing current methods and eventually disrupting the industry. Leveraging the latest scalable, secure, and seamless technology, Ascend will allow 24/7 registration and scheduling, connecting providers to patients as soon as possible. This immediate care model will create unparalleled access to resources throughout the state of Arizona, creating better outcomes for long-term recovery for patients with substance use disorder. Ascend Telemedicine is committed to serving the urban and rural populations with improved access, quality of care, and a patient-centered approach that can engage the members directly when they need it most, avoiding the delays in care seen in most treatment facilities. Now let's meet the team. Edmund L. Baker, Jr., MD, spent the last 9 years working in FQHC and rural health systems. During this time, he identified several health deserts that needed to be addressed. As the past chairman of the Women's Health Clinic at Mountain Park Health Center in Phoenix, Arizona, he built a robust, high-risk pregnancy clinic to service the uninsured and underinsured populations. In his current role, Dr. Baker recognized that his patients who sought treatment for their opioid use disorder did not have access to care. With the help of Joshua Leslie, Ascend Telemedicine was founded to treat this epidemic in a novel way. Dr. Baker's non-traditional path to medicine began after serving in the U.S. Army. He began a corporate career with PI DuPont et Nemours, where he managed an account with the Automotive Products Division. After retiring at 35 years old, he began his education at University of Michigan Medical School, then trained at the Phoenix Integrated OB/GYN program. Joshua Leslie, co-founder and chief operating officer of Ascend Telemedicine, was recently named the top physician assistant in America by Point of Care Network. Joshua is driven by the philosophy of creating unique solutions to those patients who can't access standard healthcare delivery models. A graduate of Gannon University in 2006, as well as a black belt in Six Sigma, he focuses on lean processes and quality improvement techniques to provide psychiatric and substance abuse treatment across the continuum. Working as the Vice President of Operations at Connections Health Solutions, he has managed all areas of operations for inpatient, outpatient, medically assisted treatment, and crisis stabilization. As president of iLink Technologies, he has extensive background in telepsychiatry, linking provider resources directly into patients' homes safely, effectively, and has seen the value of removing barriers to care.